New Mexico has real problems with its suicide rate, with overdoses, big issues, certainly. A new study by the federal government says the state also has issues with its behavioral health system, particularly when it comes to lower income and rural patients, particularly. Now, most providers, the report says, can't meet state standards of being able to schedule an emergency session within 24 hours or a regular appointment within 2 weeks. And Michael, the numbers are not good here. You can't get a regular appointment in under 3 weeks to 3 months. I mean, it's just an unbelievable thing. What do people need to know about the system? You've been around this for a while, going back a couple of administrations. Is it worse than we even know? Is that what's going on here? Because it sounds like for rural folks, this is a real dead end here. Unless something absolutely drastic happens, what we're going to talk about here in a second, nothing's going to change. What's your sense of it, why this is even happening?
Well, part of the reason is we're in New Mexico, I guess. I hate to say that, but I mean, this is not a new issue, and it's not an isolated issue. Mm-hmm. It's part and parcel of New Mexico's history, poverty, mm-hmm. the sort of a colonial mentality in some mm-hmm. cases. Mm-hmm. I mean, there's many factors. I may have mentioned that I actually worked for the behavioral health company that was created, Value Options, under the Richardson administration, which was to create a comprehensive behavioral health system back in 2005, and came back home and headed up the Native American Region 6 office. Conceptually, it was a good idea, mm-hmm. and but I guess one of the questions I think somebody should ask is, that was an effort. We know what happened under Martinez, mm-hmm. which was just the worst mm-hmm. thing that could ever happen. But I guess one of the places I would start would be to look at what happened. Value Options had the contract for 5 years, lost the contract. Mm-hmm. It went to another company, and then I'm not sure where it all ended up. But the bottom line is New Mexico's a poor state. Right. It's rural. Right. And it has the cultures which American Indian, rural reservations, mm-hmm. Hispanic, and poor whites, and everybody else is in the mix. Mm-hmm. I think until there's really one steps back and looks at what's gone on in the past, I think that might be a key to understanding what it is we need to do in terms of developing an effective, comprehensive model and approach. Mm-hmm. I guess the thing that's really sad is that this is not new.
Not at all.
It's like watching a bad movie that keeps replaying.
That's right.
And I'm not saying there are any easy answers, but one of the answers may begin to look at it's really about creating. It is about healthy families, but it's healthy families and children within the context of healthy communities. Mm-hmm. Social determinants of health are part of that. And I think also looking at the people recognizing that we may never ever have enough of providers. And one model that I was a part of this last year getting legislation passed was the dental health aid therapist legislation, which is training community-based people to provide some care in the community. Mm-hmm. They're from the community, they know the culture, language, traditions, and they may be more invested in the community and want to stay in the community. Right. And maybe instead of looking at models that come from other places, we need to develop our own sort of model.
Good point there. Absolutely, Jeffrey. The idea that, while Michael was talking, it struck me listening that the numbers for our kids with suicide are not good. The latest report shows a rise that we've had over the past bit of time. Yeah, something's clearly not working here. Yeah. What's your sense of what has to work? I appreciate Michael's point. It has to be folks from the community. But is it just dollars? Is it just will? What's missing here?
Well, in terms of suicide, I think the rate went up 8% in 1 year, relatively recently. Right. But in terms of the actual physics of the problem, I think part of it is lack of broadband in communities, urban communities. Right. Telehealth care is a big new technology that actually does work. You can actually Skype to a doctor, nurse practitioner. I have some property in Aragon, New Mexico, which is the Gila. my neighbor tells us, and this is somewhat anecdotal, but I think it's a reflective of the problem. When he had an issue with a broken leg, he didn't see a doctor for 3 weeks. Think about that. Further,
Yikes.
well, because the doctor was on vacation. Those are real issues that happen in rural communities.
Wow.
The second thing is there just is an absence of health providers in those industries.
Right.
So I think you have a combination of lack of people that actually can provide the delivery of behavioral health on the front line, and just absence of infrastructure, bad roads, broadband. But there was something encouraging recently that I read on this issue. Apprenticeship programs, I think the Workforce Solutions Secretary thought if you can integrate some apprenticeship programs instead of a 4-year college degree to support healthcare providers,
Right.
maybe I can be an assistant nurse, an assistant, a coder to that position. So there is some encouragement there. And I will say, I can't believe I'm saying this out loud, but I will applaud Heinrich and some of the Democrats who have actually allocated a couple, $3-4 million to this issue. I will applaud them for that. But the other issue that people don't talk about within this context is lack of continuity of care. If I see Merit in Aragon, New Mexico for an issue, I may not be the same doctor when I see her again.
That's right.
So that fluid, consistent continuity of care may be interrupted, which could jeopardize her convalescence. I'm using Merit as an example.
As I hear Jeffrey, Laura, I can't help but, we've talked about this at this table so many times, it's incredible. And that one thing about broadband, it always comes up, it's even in the report that we're riffing off of here, it never seems to get enough traction in the legislature. Do you know what I mean? It seems so simple and so easy, but it's not, is it? It's just a difficulty.
Well,
How do we shorten that gap there?
I mean, I think there needs to be strong leadership on the issue. I think there needs to be a comprehensive approach. There's a lot of factors.
Right.
Broadband is a huge issue, and I've been at some of those committees where they discuss it. I think there is support among legislators, but I think that we also have a very unique kind of legislature where there's time-sensitive issues, and it's very difficult to get your issue out there when it's that that big to try to put your arms around. But I will say that again, we're a rural state, but I think these issues don't just happen in rural communities.
Right.
Even in the urban areas. I mean, and at the risk of oversharing, I just tried to make an appointment with my behavioral health provider, and my next available appointment was October 29th.
Right.
It was like, that's crazy.
That's right.
You're talking about 5 weeks, 4 weeks before you can get in to do stuff, and that's somebody. Obviously, I can advocate for myself. I can do other things, but there's a lot of people who can't.
That's right.
And aren't able to do that, and don't have options, don't have other providers as part of their network, and it's a very serious problem that I think that we have to figure out at some point. The suicide rate we should all be completely appalled by. It's not something that we should just accept.
That's right.
We have to do something about that. It's
isn't
outrageous.
Of something bigger. It really is. It's really unfortunate. I mentioned money earlier, a second ago, Merritt, about, let's put it in this context, the county. We've got the tax that's been in place here for a little bit. The kitty's starting to grow a little bit. It's actually a pretty good amount of money. From your point of view, again, we're talking about rural versus urban, but just urban for a quick second. Enough money there? Are you sensing a possibility? Because we have some options now, and to start talking about $19-20 million. So.
Well, and the interesting thing with that is nothing's been done.
Right.
And so that's awesome. Okay, so we bit the bullet. We paid some more taxes. We have a fund. Where's the plan? And I think what everyone said here is completely valid. We have a climate, even here in Albuquerque, where healthcare professionals don't want to stay. Particularly in places like Silver City or Lovington. Also, just the education issues for them to raise a family. I mean, it all kind of snowballs in this. And I do think one of the best uses for the funding in Bernalillo County or the funding that we're getting from HHS would be a ground up what New Mexico needs program.
Is there an opportunity?
I hope so. I hope so, because
great minds leaders can sit down and.
I really hope so, because I think one of the most shocking things to me in the last 10 years in behavioral health is after various folks lost their license and some firms from Arizona were brought in, they couldn't deliver because they said, this is such a mess, we have to charge you so much more, there's no way we can deliver services under a contract because we're not even equipped to deal with this. That's something.
Yeah, that says something. It is a money threshold, isn't it?
Well, I just want to follow up on her comment. What was done in terms of the fact that the system here was dismantled was, I'd say, almost criminal. Was criminal because you turned all of these people out onto the street with no
Continuity.
access to care. That's just, so we're almost like starting from scratch all over again.
Right.
I think the one thing I would like to say, though, that I think is treatment is critical and an important piece. And you end up with families that it's one of those gifts. It's a sad gift that it keeps on giving, where there's substance abuse, drug abuse,
Right.
and
That's
family
right.
disintegration.
That's right.
So the other piece is beyond, in addition to treatment, really has to be an investment in prevention. And that ties in schools, and that ties in the churches, and that ties in civic organizations to really create an environment that is positive and supportive and encouraging of children, mothers, and families, because what we oftentimes see also is single mothers raising children on their own.
That's right.
And so I think that prevention piece is really critical.
Right. Touch on that, Jeffrey. That's a good point there.
Well, I wanna
Are
come
we
back
willing to pay for those things, the
I want to come back
prevention
to something
side?
Merritt said.
Please.
Recently, I thought the county had a novel approach such that communities within population sectors could themselves, from a bottom-up approach, apply for funds. Because think about this. If you're a community where I grew up in South Broadway, you had a different issue than maybe the Southeast Heights. Maybe there's suicide in my area, maybe there's drug abuse there.
Right.
So I think this approach recently unveiled by the county, such that instead of top-down, it's bottom-up. The communities know their own issues, and you can nuance those through applying for funding, through a procurement process. I think that's a novel approach that speaks to the heart of, I think, what Michael talked about as well. Communities have their own distinctive cultural, anthropological problems such. They should apply for resources based on those issues.
Glad you got that in. It is kind of innovative, isn't it? To allow folks to say, this is what we need in micro communities. That's actually a really good point. I'm glad you brought that up. Going to take a moment to reset and refill our mugs over here. When we come back, we're talking about changes to Balloon Fiesta security this year.